You are watching Canadian Muslim News on Muslim Network TV from Toronto, Ontario. I'm Catherine Bullock. Assalamu alaikum and greetings of peace. Coming up, we will talk to SHAHINA SIDDIQUI, who is organising a conference for a new institute for Muslim mental health. But first, some news headlines. Canada calls UN's report on Uyghurs critical. Muslim organisations being denied banking services in Canada. Brantford pharmacists to donate medications to Pakistan flood victims. Palestinian prisoner ends 170-day hunger strike. And now, the details. Melanie Joly, Canadian Minister of Foreign Affairs, says that the UN's report on human rights violation in East Turkestan shows that Muslim ethnic minorities are facing discriminatory detention, which may constitute crimes against humanity. In a statement released yesterday, Joly says that Canada has addressed the gross human rights violations with the Chinese government at the highest political level. The UN's outgoing human rights chief, Michelle Bachelet, released the report Wednesday, calling on the international community to respond to the allegations of torture in Uyghur detention camps. Several countries and UN officials were anticipating the report for months. However, the report's release was delayed due to pressure from China. An investigation carried out by the National Council for Canadian Muslims, or NCCM, reveals several financial institutions refusing to serve Muslim organizations, including mosques, charities, schools, community centers, and advocacy groups. According to the report, major banks are telling Muslim organizations to wind up their financial transactions within weeks and immediately cease online fundraising activities. NCCM states that Muslim organizations are not given a clear answer as to why the banks are dropping them. Often a vague reason of risk assessment is provided to the Muslim organizations that have been carrying out transactions with these banks for years. Anwar Dost, a pharmacy owner based in Brantford, Ontario, is donating $10,000 worth of medication to flood victims in Pakistan. Dost is set to deliver the medications upon his arrival in Pakistan within the next 2 weeks. Dost and his wife also run a charity which is helping more than 100 families affected by the floods with food supplies. The Canadian government has announced a fund of $5 million to provide humanitarian assistance to Pakistan. This year, Pakistan has received 190% more rain than the average. The unusually heavy monsoon rains have destroyed infrastructure, homes, and crops. Khalil Awalde, a Palestinian prisoner who Israel detained without charge or trial, has ended his 170-day hunger strike, now that Israel has agreed to release him. Awalde's lawyer confirmed to a media source that the 40-year-old will be released in October. Until his release, Awalde will remain in the hospital for treatment. Awalde started his hunger strike in December last year to protest administrative detention by Israeli forces. Administrative detention is an arrest made by Israeli forces on secret evidence, leaving the detainees with no right to defend themselves. Human rights groups say the system abuses so-called suspects. There are about 670 Palestinians in administrative detention. And that's it for the news. The Institute for Muslim Mental Health Canada is hosting a conference this coming November in Winnipeg, inviting social workers, imams, counsellors, and mental health professionals to come and discuss Muslim mental health. The need for organisation and the plan for the conference, we are joined by the host organisation's Executive Director, SHAHINA SIDDIQUI. Assalamu alaikum and welcome to the show.
Wa alaikum assalam.
Thank you for joining us. Several boards of health in Ontario have labelled anti-Black racism a public health crisis, and likewise some scholars in the US have called Islamophobia a public health crisis. Can you tell us what they might mean by that?
You know, Kathy, along with social isolation, the issues that have come up in the past few years have exacerbated the issues that were already there. For example, domestic violence, trauma, family breakdown, increase in mental health concerns, depression, addictions, homelessness. All this is have literally come bubbling to the surface. And we do not have an organized institute and a hub where we can do research as well as do the services. And it was important that we bring it to a national level.
That's the idea of the conference, which I will ask you about in a minute. But I just want to dwell a little bit more on the issue of mental health. We know that in the Muslim community, people, when they have mental health issues, they rarely seek professional guidance. They will often prefer to go to family or friends or to the imam at the local mosque. And there's some idea that mental health is from possession by jinn or spirits, or that you're just not reading enough Quran. So I was wondering if you could just expand a little bit on the need for professional mental health.
I mean, of course, the profession mental health is extremely necessary, but as you pointed out, our imams are not trained mental health professionals. We have this gap in mainstream services and the Muslim community, because all the psychotherapy, all the mental health supports, if they're not infused with spirituality, does not work for Muslims. So whether it be, we have been doing for 25 years the counseling and the social work with Muslim communities, and we have assessed that this is a gap that exists. So even if people believe, there's jinn, of course we believe it's in the Quran, but how do you work with it when somebody comes to you and says, I think my child is possessed and that's why they are doing drugs, right? How do you talk to them? The language is going to be very different from a mainstream provider. And so bringing the spiritual part of it, the spiritual counseling, which I have been doing for 25 years, and others, the research that is developing now is amazing, and the young people involved. So filling that gap, making Muslims feel comfortable to go for counseling. You see, for even mental health is a taboo in the mainstream, leave alone other minority communities. So to breaking that barrier and saying mental health is mentioned in the Quran, it's part of the Sunnah teachings on how to work with depression, how to work with other issues, and so that builds that trust for people to come to us. And of course, those providing it should be professionals, right?
That's a good point. I'm going to move to the next question in a minute, but before I do, do you mind just muting the phone so that we don't get distracted during the rest of the interview?
They've already done that.
Thank you. Yeah. So you talked about the need for professionalism and the need for training, and I'm assuming that's one of the reasons why you're organizing this conference. When I look up Institute for Muslim Mental Health, I find an organization with roots in Michigan. So can you tell us a little bit about the relationship between your association and the one in Michigan?
Yeah, absolutely. They're one of the advisors on our advisory council. A year ago, we put our advisory council together because we needed to know, do we really need it and what we need? So it includes Americans. We have psychiatrists, psychologists, imams. We have social workers from both North America, all across. And we sat down and we've had meetings. And then the firm that we hired to do the strategic planning for this also had one-on-one interviews across North America. There's a lot of research in Muslim mental health issue in the United States, very little in Canada. And that's one of the gaps that we want. We wanted to learn from them, but also do something that works for Canada and Canadian stats and Canadian issues. So that's why, and they're part of the people sponsoring also our conference, is to learn. We don't want to reinvent the wheel, Kathy, right? We know there is a lot of work already done. But how do you bring it to Canada? How do you make it practical, not just a research paper sitting somewhere, but taking that research, putting it into action, developing the programs, and then delivering it.
And is it your sense that there's differences between Canada and the US?
There are. Remember when my organization, ISA, started, we were both North American. And then in 2-3 years, we realized we had it to split. And split not because we had a problem, but because the culture was a little different. We have the parliamentary system, they have the presidential system. So when you're doing advocacy, there has to be a different approach to your issues. Also, we are more community-based. The provinces have their own reality, their own cultures. And so this is why it was important to have a national institute with a national outreach, but also giving the autonomy to the provinces, to the different sectors, to apply the research and apply the training and make it relevant to them. Because sometimes we think we can, with the same brushstroke, everyone, it doesn't, right?
So is this the first of its kind? Is this the first conference on this issue nationally in Canada?
It is the first. We've had professional conferences for psychologists and the School of Mental Health or doctors, but this is a different focus. It is bringing everyone from the professionals to the practitioners to the imams, because these are people who are going to increase the knowledge, will do the research, will do the training. And our focus is not just on the Muslim community. We are going to learn from the Indigenous community. ISA works very closely with Indigenous communities, and the models of restorative justice, of healing circles can be adapted to the Islamic concept of these two issues, right? So we want to make it truly Canadian. We want to learn from what's already there, but we want concrete services, and we'll train. I mean, give you one example if we have the time. Kathy, when the tragedies happened in Quebec and in London, Ontario, we were so focused on the media and the politicians, that we were not paying attention to the mental health issues, the grief, the mourning that was going on, not only within the family, which is obvious, but also the community. There was vicarious trauma, and we didn't have grief counselors to send. Right? So we would do that training for volunteers for first mental health, first aid, but infusing everything with spirituality to make it uniquely for Muslims, by Muslims.
Which seems to be very pioneering. Do you think that this has been bubbling under the surface for many, many years, and now something's just sort of clicking and coming together?
We are speaking up more. There is more research. 28 years ago, when I presented my paper on spiritual counseling, there was hardly anything going on in North America on that. And now many of people who are my students and others have done amazing work. But one thing I want to make sure that people understand is that when you're talking about spiritual counseling, the counselor themselves have to be trained as well. Right?
Having a focus on train the trainers.
Yes, there will be a focus on that as well. And so very comprehensive approach. The consultations have been very encouraging, very informative, and just that everybody is coming together. So now after the conference, the hard work starts about the fundraising, about, we got some seed money from Toronto TD Bank for putting this initiatives. We are getting some from the city. We are hoping federal government will come through, because major reason, and I'll end with this, is if we do not pay attention to these issues today, 10 years down the road, the taxpayer will be paying for it.
They will come back to haunt us. And unfortunately, we're out of time. So that was a good way to end it. Thank you for joining us, and we wish you well for the conference.
Thank you, Kathy, and hope to see you there.
Thank you for watching. If you like what we do, please share, like, and subscribe. Stay safe, and God bless.